All right. Well, welcome to the Let's Talk Thyroid podcast, where we cover all things thyroid related positively and practically. And look, in a recent episode, I spoke with Whitney Morgan all about root causes of Hashimoto's and hypothyroidism. And whilst there are lots of overlaps for those of you listening with Graves disease or hyperthyroidism, there are differences. And I know sometimes you Graves listeners get overlooked in the thyroid discussion, so I'm really looking forward to diving in today with my guest, Dr. Eric Osansky, talking all about Graves disease causes and natural treatments. I've been following Dr. Osansky on his Facebook page for a little while, listening to some of his podcasts, and he does regular Facebook Live Ask Me Anything segments, and I've watched some of those. So I was really excited when he agreed to be on the podcast. Dr. Osansky is a chiropractor, a clinical nutritionist, and a certified functional medicine practitioner who helps people recover from thyroid and autoimmune thyroid conditions. He's the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves Disease and Hashimoto's Triggers, and is the host of the Save My Thyroid podcast. Dr. Osansky, like so many of us in this space, has his own thyroid story, and he was personally diagnosed in 2008 with Graves' disease after taking a natural treatment approach, was able to feel so much better. And so dived right into helping other people with hyperthyroidism and Graves' disease, and really the full spectrum of thyroid disorders, also working with people with hyperthyroidism and Hashimoto's. So welcome, Dr. Osansky, to the Let's Talk Thyroid podcast. Looking forward to diving into this discussion all about Graves' disease and hyperthyroidism with you today.
Yeah, thanks, Annabelle. I'm excited to be here, and looking forward also to chatting about hyperthyroidism and Graves.
Yeah, do you find it gets overlooked a bit? I mean, I guess it's probably a bit more your space with that being your story, but I find, I guess us Hashimoto's people, there are a few more of us. So do you find that there's that a bit?
Yeah, without question. I mean, I have a lot of people who find me and, they resonate me because of my story, but then they tell me, hey, I can't find, everything out there is related to hypothyroidism and Hashimoto's, and there's, of course, a reason for that. One reason is, and probably the main reason, is because there's a lot more people out there with hypothyroidism and Hashimoto's. But I would agree that it tends to get overlooked. There's not as many resources out there for those people with hyperthyroidism.
Yeah. Yeah. And I know there are some overlaps, but obviously completely different in so many other ways as well. I'm wondering, Eric, do you mind just giving us a little bit of your story? Because, it's always nice to get to know people a little bit more and, what kind of got you into the thyroid health space.
Sure. So, as you mentioned earlier, my background is actually a chiropractor. And for a number of years, I was just practicing traditional chiropractic. And, I will say that where a lot of chiropractors, they take continuing education credits for chiropractic, I always would take continuing education credits that related to nutrition. And, a couple of those were actually functional endocrinology conferences. And so I was diagnosed with hyperthyroidism in, again, 2008. And initially, I didn't know I had hyperthyroidism. I was just walking around. Here they have, I don't know if they have Sam's Clubs in Brisbane, but it's like a big it's a big retail store, wholesale place. And anyway, long story short, I was walking around. They had one of those automated blood pressure machines, and I took my blood pressure, which was fine. But then the blood pressure was fine, but I was I had an elevated resting heart rate. And, which was unusual. And, again, just the next few days, I would take my heart rate, measure my heart rate on my own and, remain elevated. And so eventually I went to a primary care doctor, was diagnosed with hyperthyroidism, and I was putting the pieces together because I was losing a lot of weight, but I was also exercising, detoxifying, dieting. So I was attributing to that. But obviously it wasn't solely due to that. And then, so, just I went to an endocrinologist and was diagnosed with Graves. And then from that point on, from my background, as I mentioned, I was taking a lot of continuing education credits related to nutrition and a couple of functional endocrinology seminars. And so I had in my mind that I was going to tackle this naturally, that I wasn't going to follow the traditional approach. And not to say there's not a time and place for that, but again, long story short, took that natural treatment approach that you mentioned, changed my diet, did some testing, and, of course we could talk more about that. And, eventually got into remission. And since then, I've been working with people with not only hyperthyroidism, Graves disease, but also with hypothyroidism, Hashimoto's. But I will say that the majority of people I work with do have hyperthyroidism, and probably just because of my background, just because, again, a lot of people resonate with me. And as we mentioned, there's not as many resources out there related to hyperthyroidism.
Yeah. Was it, obviously you have that natural health background and professional experience. And as you said, you're doing all that extra kind of research and learning kind of in that space. But was it, did you feel like you were being pushed down that mainstream kind of medication approach and blast the thyroid, or were you able just to sort of sidestep some of that?
Yeah. So when I was dealing with hyperthyroidism, actually when I saw the primary care doctor, of course, he wanted to give me, medication. He gave me a beta blocker, to manage the symptoms. And then when I went to the endocrinologist, she did recommend antithyroid medication. Here it's methimazole is most commonly recommended, also called tapazole. But she really didn't pressure me as far as the radioactive iodine thyroid surgery. That is common for endocrinologists to bring that up, but she was pretty conservative. But, as I started working with others, I realized that it was common for endocrinologists to put pressure on their patients. And so I was lucky. And I only saw her for that single visit. I really was going for the diagnosis because my situation, I chose not to take the antithyroid medication. And again, we could talk more about that because there is a time and place for that. But if I wasn't going to get the medication and I was doing blood tests on my own, there was really no reason for me to continue seeing her. So, but thankfully she didn't. Thankfully, she didn't push me towards the. If she did, it would have made a difference because again, I wouldn't have listened. But a lot of people, unfortunately, do listen to the endocrinologist and end up receiving radioactive iodine.
Yeah, well, I guess not everybody has the same. Obviously, is coming from that openness to natural health perspective from the get-go. A lot of people, we end up there, but we don't always end up starting there. Yeah, it's so you just dived then straight into sort of what was your, when you say you took a natural treatment approach to your for you, what did that look like for you, particularly in those sort of early days?
So diet was a huge part. And, so there's obviously different types of diets. And, at the time I followed more of a paleo type diet. And, but the big thing was stress. I think in my situation, stress management, played a big role. I also did testing to, and that's why I did the stress management, because I saw how bad my adrenals were. I did, in my situation, adrenal saliva testing, and it looked pretty bad. I had cortisol low, DHEA low. Pretty much everything was low. And so diet, stress management, certain supplementation, related to, the findings of the test. And, I will, going back though, one thing that's important to say, and I'm sure some of your other people you interviewed have potentially mentioned this, but overtraining is something I was doing when I was prior to being diagnosed. And so it's not just emotional stressors, but I definitely was working out too hard at the time. I should have been aware with my background, but yeah, so I think that's important to mention. So when the part of the natural treatment approach was taking it easy, not working out excessively, still keeping active, but with hyperthyroidism, you do want to be cautious, because especially if you have that elevated resting heart rate, so I definitely wasn't working out as intense than I was in the past. And but yeah, a lot of it diet, stress management, supplementation based on the testing I did. Doing things to reduce my toxic load, so doing like things for detoxification. So it was a number of different things. It was not just diet I think is a big piece of the puzzle. But a lot of people come to see me and they've already done a lot with the diet because, of course, there's so much information out there. And so there are people that have followed paleo, they follow autoimmune paleo, AIP, and, and that could help greatly with a lot of people. But for some people, actually, a lot of people, I feel they need to go beyond the diet. It's just like a piece of the puzzle. But yeah, that's essentially what I did. And that, I guess, is what entails the natural treatment approach that I took.
Yeah. And I think what we'll do in a minute is dive into each of those areas, in that broader sense. But I think it's always helpful to understand, and everybody's story is slightly different. And, I'm a big advocate for people sharing their stories on this podcast because I do think, there'll be people that will resonate to you in a way. Obviously, they're not going to resonate to me. I've got Hashimoto's, not Graves, but even other, Graves. I've had a couple of other people with Graves on the show, and everyone resonates with different people differently. And so I think that's one of the benefits of getting lots of stories and experiences out there. So I'm just wondering, Eric, if you look back, because one of the things we want to talk about is the causes and the triggers for Graves' disease. But, now that you've got obviously the benefit of a lot of hindsight, did more things make sense to you? Like when you looked back from when you were diagnosed, could you kind of make some connections then, as you said before, like say with the overtraining, and were you able to kind of work out what the most likely causes or triggers for you were?
Yeah, well, again, the stress was huge. I mean, the thing is, which I'm sure Annabelle, I'm sure there were multiple things. Like again, I cut out.
It's never
all
one
the,
thing.
Yeah. So I don't know. Like I never felt bad. Like for example, when eating gluten or dairy, but it's not to say they weren't potential triggers or at least affecting the gut. Maybe increasing intestinal permeability. Causing a leaky gut. So, but like I said, if I had to pinpoint, one thing, would have been the stressors. A combination of emotional stressors as well as the overtraining, but again, yeah, there definitely could have been other factors, like again, diet, and, I also was doing things to reduce my toxic load, but, it's hard to measure, like you could do testing for heavy metals and other, environmental toxins and, but there's only so much you could do in that area. So again, who knows how much that was playing a role. And I think, I don't know if you would agree with me, but I think in this day and age, that's a huge area that gets ignored because again, diet and stress are important, but the one thing that has changed, just over the last few decades is, our environment is getting more and more toxic. So, I do think that, and so I think that's not only played a big role, in regaining my health, but that's one thing I've done, I think a real good job over the years. And when it comes to maintaining my health is just continuing to do things to reduce my toxic load, trying to, of course, minimize exposure to environmental toxins the best I can using, like eating organic food, using natural cleaners and products, but then also doing things like sauna therapy, sweating out the toxins, again, taking certain supplements to detoxify, of course, trying to do as much as I can through food.
Yeah, no, I totally agree. And it is one of those things, like I think, I know for me, when I started really taking more of that holistic approach to manage my Hashimoto's, I started with the food. That was really where I started. But, I'd learned over time that was, I really do believe that's a very key part. But as you say, there's many, many other parts. And so we have to take this holistic approach. And now I just say it's never one thing. Like it's never one thing that got you into the mess. It's never one thing that's going to get you out of it. It's this. And so it is hard to pinpoint. But yeah, I probably about 5 or 6 years ago, I started really actively reducing the toxins for me. Same sort of thing. Natural cleaning products, getting rid of all the candles and the synthetic fragrances and just even gradually over time, like putting a water filter on the, water filters and reducing the plastics in the kitchen and, those type of things, like just that gradual, bit by bit, item by item, switching it out. But I think you're right. A lot of people don't talk about it.
Yeah. And like you said just now, a lot of people need to do it gradually. So I don't want people listening to this to get overwhelmed and say, wow, I can't make all those changes at once. It's, I would say if you're going to start with one thing, start with the food and water, just make sure you try to eat organic as much as you can, and definitely don't drink like tap water or water out of a plastic bottle on a regular basis. And then from there, you could expand and then, try to use more natural cleaners and cosmetics. And even if you start with one or two of the ones that you use more frequently, and, we have like air purifiers, and we've, over time we got, now like more of a more natural mattress, and we're still not perfect. I can't say our whole house is furnished with 100% natural furniture and, that I never eat organic food. And I mean, we're not perfect, but, nobody is. And we're just, it's always a work in progress. But, again, if you want to focus on at least the more important areas, and then, because again, we have like air purifiers here and in my office, but as soon as you walk outside, there's nowhere, or, you walk into another person's home or in a business, another business, again, so you can, the thing is, you obviously can control your environment to some extent. You can't really control the outside environment. And so I would say just do it gradually and don't get overwhelmed, but I think it is something that's important to do, just because it's not getting better, the situation. If anything, it's getting worse.
Did you know that one of the best ways you can support the Let's Talk Thyroid podcast is to buy one of my products? It not only will benefit you in your thyroid health, but it helps me to have the funds to keep the podcast going. So whether that's the book or a strategy session or signing up for the Kickstart Your Thyroid Wellness program, you'll find them all on letstalkthyroid.com. And this time of year could be a great Christmas present for yourself or for a friend, so that they can start the new year all ready to go with living a thyroid-friendly lifestyle. But really appreciate all your support in whatever form it takes. Even just listening to this podcast is fantastic. So lots of different ways you can support the podcast. Yeah, so a couple of years ago, I took one of Dr. Karassian's thyroid courses, and that was, I think, when I was like, right, wow, okay, the toxic load, I was already on that journey, but he was like, it's really significant, with thyroid health. Thyroid's so sensitive, you really have to, really reduce all the thing that really stood out to me was, the plastics. And I was like, right, okay, we're getting rid of every plastic container in the kitchen. It's all glass now. But it's a gradual process. But I figure we're kind of in this life thing for life, so we don't have to do it all at once. It can take time. So I like your approach as well. I think we're pretty similar in that way. Yeah, that was really good, that course, actually. I do like, I've learned a lot from him over the years. So
yeah, I have too. I've attended some of Tatis's, Dr. Karazian's courses, and I found them to be helpful as well.
Yeah. So why don't we just take a step back into really looking, we sort of talked about what you think might have been the triggers for you, but let's just talk a little bit more broadly then about, those root causes and triggers, for those that are listening with Graves' disease that maybe haven't even thought about, what causes it, how did they end up with it? Maybe we can have a chat for a few minutes about what are the typical kind of causes or triggers, and is it important to try to work out what they are, and if so, why?
Sure. So I commonly discuss 4 categories of triggers, or 4 main categories of triggers. So 1 would be food, 2 would be stress, 3 would be chemical, 4 would be infection. And so just expanding on, each of those, again, food, to me, food is very important, but a lot of times it's a piece of the puzzle, but it's an important piece of the puzzle. If someone's eating inflammatory foods, they're still eating gluten, it's really going to be very difficult to recover. So you definitely want to avoid common allergens. There's no perfect diet for everyone. I mean, I like paleo, I like autoimmune paleo. Autoimmune paleo to me is more of a temporary diet, whereas like paleo, you could, like most of the time I'm paleo,
me too.
I can't say 100%. Sometimes I'll stray from that, but yeah, so either way, you want to definitely, I would say, be really strict while trying to regain your health. So like I just mentioned, I'm not perfect, now, and not to say that you need to be perfect, but if someone, is trying to regain their health, you really do want to be strict with things like gluten and, in my opinion, dairy. So, if someone's like 90%, 95%, that might not be enough. And we don't want to go back and say, hey, like if someone's not recovering, was it the food or was it a different factor? So I would say, make up your mind and just say that you're going to, be strict with the diet. And it wasn't easy for me. For a lot of people, it's not easy. But so that's one category of trigger. I mentioned stress already, the emotional stressors, physical stressors like overtraining, even like we could put like stored trauma, into that category as well. And, then, the chemicals we spoke about a little bit as well. Just there's so many different environmental toxins, heavy metals, xenoestrogens, glyphosates. So I don't know if glyphosate's as big of an issue in Australia.
Yep.
Okay. So
it is. Yep.
Yeah. So yeah, just, again, it's just never ending. So that's why you want to really do a good job of detoxifying. And I should mention, I do sauna, which I did mention, but I didn't do sauna while I was dealing with hyperthyroidism. It wasn't until a few years later that I got a sauna. So I can't say it's absolutely necessary to get a sauna. Yeah. I don't want people to have heard that and say, oh, wow, I can't afford a sauna, or, I just don't want to do a sauna. And honestly, if someone has hyperthyroidism, you want to be cautious if you're doing sauna, just because it raises your heart rate when you're in the sauna. I was just about
to ask that. So maybe that's more of a maintenance in the terms of hyper.
Yeah, it depends on the situation, but yeah.
So, okay.
And infections. So we didn't really talk about infections. No. And, again, I'm sure some of the other, your other guests have spoken about this, but, there's different types of infections, viruses, such as Epstein-Barr, gut infections, such as H. pylori, stealth infections, such as, Lyme disease and Bartonella, and all these could potentially be triggers. And sometimes they get overlooked. I was diagnosed with chronic Lyme disease in 2018. And so this was 10 years after my Graves disease diagnosis. So it wasn't related, but I have seen cases where it was related. And, and I had no history of a tick bite, no history of a rash, so again, you can't always go by the classic signs and symptoms. And, I just actually consulted with a patient this morning as we're recording this, and, thinking maybe does he have some type of stealth infection just based on his symptomatology. He's a hyperthyroid patient, but he's having some unusual symptoms. So I'm thinking, does he have like a Lyme or, Bartonella? Actually, he has some like night sweats. So I'm thinking like babesia, if you're familiar with babesia. It's a parasite. But and usually also tick-borne, like it's very common to have like babesia in combination with Lyme and Bartonella. When I dealt with it, I had Lyme. Bartonella did not have babesia. But again, so you can't, like I said, you can't always go by classic symptoms. Toxic mold is really more under environmental toxin category, I would say. But I'm bringing this up because the person I was working with this morning, that's another thing I was thinking about, maybe if not Lyme, toxic mold. A lot of times they kind of go hand in hand. But the infections, even with H. pylori, like if you look up H. pylori, some of the classic symptoms would be like heartburn and reflux. And not everybody has digestive symptoms when it comes to H. pylori. And there's controversy too. There'll be, some practitioner will be like, well, H. pylori is normal in the gut flora. So, and it's true. It's not always a trigger. That's the challenge. Like most of us have Epstein-Barr, and we can't say that Epstein-Barr is always a trigger of Graves and Hashimoto's. it's a potential. But I think a lot of it goes back to the toxins, though. Like, it's not so much, like, especially when it comes to viruses like Epstein-Barr and other types of viruses, not to say I never do things to address the virus, but I'm always trying to figure out, well, why is the immune system compromised in the first place? Usually when you address other imbalances, whether, again, it's reducing toxic load or reducing stress or correcting nutrient deficiencies, again, all those things could help to improve the immune system health. And, to me, that's if you just go and, put someone on a antiviral protocol, let's say an herbal protocol, a homeopathic protocol, but you're not doing other things, you're not improving the health of the gut and, just addressing other potential triggers and underlying imbalances, it won't be completely effective. But those really are the main 4 categories. And, we could also, if you want to talk about, like, how do you know, if you have, a gut infection, or how do you know if you have, again, adrenal imbalance. And I mean, the truth is sometimes you can't test for everything. I mean, there's a lot of testing out there. I am more conservative with the testing. I mean, I do recommend testing, but I don't try not to go crazy with the testing. I mean, like for food, for example, I do more of an elimination diet. Some practitioners do food sensitivity testing. It's not that one is better than the other. I mean, I think we all have our biases, and there's, to me, there's definitely flaws with some of the food sensitivity testing out there. But there's also flaws with the elimination diet. It's not perfect either. And, I've also dabbled with combining the two, doing both. But yeah, so that's another option, and, same thing with stress. Like some will say, well, why don't, I know I have problems with adrenals, so why test for adrenals? And I like testing just because, there's different patterns and, that could dictate different treatments. I mean, regardless, of course, you could manage stress, do things to improve stress handling, regardless of whether you do testing or not. But I do like doing adrenal testing. And there's saliva testing, which is what I did. There's also dried urine testing or Dutch testing or, different types of dried urine testing, not just the Dutch. But and then, for I mentioned for environmental toxins, there's only so much we could do. There's, looking at, like through hair or urine for heavy metals. And then there's other types. You mentioned Dr. Datiz Karazian, who, he works closely or used to work closely with Cyrex Labs, and they have some pretty neat tests for environmental toxins and actually food sensitivities and, other types of tests, infections. They have an infections panel. But, theirs actually is looking at the immune system response to environmental chemicals, whereas most of the other tests are looking at the levels. But, yeah, and then there's, for when it comes to infections, it also gets tricky because, if we're suspecting a gut infection, you could do you could just test, I guess, for H. pylori, or you could do a comprehensive stool panel. If someone was suspecting SIBO, which is not really an infection, it's just too much bacteria in the small intestine. There's a breath test for that. For Lyme and co-infections, that's typically looked at in the blood. But also you could have false negatives. So, I guess
there's a very big array of tests, isn't there?
Yeah,
it depends on how big your budget is too, because
exactly.
Yeah.
And I don't do most of these tests. I'm throwing things out here.
No, you're just saying this is
I'm not recommending those. Yeah. And again, you got to be, I mean, sometimes stealth infections, that's what I left off with. But like I said, you could do a test for stealth infections and it could be negative, for Lyme and Bartonella, but it depends on, the testing that you do. And, it could get confusing. And, so that's why I also want to combine testing with health history, which of course what most practitioners do, because when I was dealing with Lyme, I actually went to a primary care doctor and I was suspecting Lyme at the time, but I wasn't sure. And he just wanted to refer me to a neurologist. He didn't want to do any testing for Lyme disease. And so again, but yeah, it does get complex at times when it comes to finding triggers. And then, of course, when you find them, you got to do things to try to remove the triggers. So.
Yeah, that's right. And I think like all of what you just said, Eric, is why it's so great that there are practitioners like you, because and I was having this conversation with the podcast episode that's out this week was when I was talking with Whitney Morgan all about the root causes for Hashimoto's, and obviously there's a lot of overlap, but we were talking about this, and I said this is why we need good holistic practitioners, because for me, for example, as a non-medical person, when I hear all of that, I'm like, oh my gosh, where would I start with that? And so for the average person with a thyroid condition, this is part of the big, I think it's a globe I'm working out really from talking to lots of different people. It is a global struggle to find practitioners that know about all the different tests, know that it can, what the priorities are. And so, I guess I hope as we move forward into the future that there's more and more people, like you who can help people, because autoimmunity is so complex, isn't it? And, thyroid health is complex. So we need to have people who understand the complexity and can help us as patients sort of unravel it so that we can take this natural, holistic, lifestyle approach to our health. Yeah. So don't get overwhelmed, I guess, if you're listening to this and you think, oh my gosh, it's okay. You don't have to do it all at once. But yeah, try to find a good practitioner who can help you work through it.
Yeah, I agree. And fortunately, it is heading in the right direction. I mean, there are more and more functional medicine practitioners, more medical. I mean, there's still not enough medical doctors who are open-minded, but there are more now, I think, than there were, like 5-10 years ago. And so yeah, I mean, it's not, sometimes it could be challenging, but you mentioned earlier also there is a lot of overlap too, when it comes to Hashimoto's, Graves, and other autoimmune conditions, so it's, and you're right, like I wrote, one of the books I wrote, Hashimoto's Triggers, I could easily change the title to Graves' disease triggers and probably, make some changes. Obviously the symptom management aspect of hyperthyroidism is completely different than for hypothyroidism, Hashimoto's. But when it comes to triggers, there is definitely a lot of overlap, and yeah, it's sometimes it's even challenging when working with a practitioner, let alone if you're going to try to do it on your own. It's a real big challenge. So yeah, I can't agree more, that it is a good idea to, if you can, afford to work with someone, but that being said, also, if there is a lot you can do on your own, the listeners can, again, they could make dietary changes, they can block out time for stress management. And that's a big one, with just getting into the routine of stress management. I mean, those are big too, I should say, change your diet. And it doesn't even have to be paleo to start out with, just even like give up the gluten, start out with, avoiding gluten, go gluten free, block out 5 minutes per day for stress management. And then, maybe the next week you take out dairy and block out 10 minutes per day, and just gradually, get in that routine of stress management, get in a routine of eating well, get that water purification system, or, So, maybe do like something every week rather than try to do everything at once. And it depends on the person. There, of course, are people who are gung ho and they're ready to do everything at once. And that's fine if if you're pretty confident that you're not going to fall off the wagon. But yeah, so just, those two things, like I said, alone could have a dramatic impact. And those are things that people can do even without working with someone like you or me.
So when we're talking about symptom management, and I think this is where obviously the symptoms with Hashimoto's and Graves, well, again, there is some overlap, but let's just talk about the differences. And, when you say, how do you manage those typical Graves symptoms from this sort of natural approach? Like, I mean, are we talking about we're talking about taking out, inflammatory foods and all of what we've talked about, but are there other aspects that relate specifically to managing Graves symptoms that we haven't covered yet, or that you think we should dive into in a bit more detail?
Yes, without question. So from a conventional standpoint, I mentioned earlier where they recommend typically anti-thyroid medication for patients and sometimes beta blockers. So when I dealt with Graves, I took an herbal approach for symptom management. So I took an herb called bugleweed, which is, it's not one of the more common herbs. Like ashwagandha is one that most people have heard of. And, there's a valerian root and, like milk thistle, very common ones. But bugleweed is not one of the more, if you go into a health food store, there's a decent chance they won't have bugleweed. And so that's because it's really specific for hyperthyroidism. It can help to lower the thyroid hormone levels. And so I took that. Now, it's not effective in everybody. I would say maybe about 75% of the time it seems to be effective. But there's also, there's motherwort, which also I took. Motherwort is more, and that's also an herb, but that's more for this, the cardiovascular symptoms. So I started with the bugleweed. A few weeks later, I was still having heart palpitations, and then I added the motherwort, and that helped. And of course, that was while I was addressing the cause of the problem, because again, those are just, as we're chatting about now, just managing the symptoms. There's also lemon balm, which has more of a calming effect. So some say it has antithyroid properties, but not as much as bugleweed. Bugleweed is, to me, much more effective. L-carnitine, which you're probably familiar with. And L-carnitine, not specific for hyperthyroidism, but there is some research showing that higher doses of L-carnitine has antithyroid properties. So taking about 2 to 4 grams per day, can potentially have that effect, which I guess could be important. If someone has Hashimoto's, they might not want to take really large amounts of L-carnitine because it could possibly, have that side effect. And there's others like lithium. Lithium carbonate is typically a prescription, but there's lithium orotate, which also can help lower thyroid hormone levels. But so those are some of the main symptom managements. In most cases, I'll start with bugleweed because it seems to be the most effective. Bugleweed and motherwort, that combination.
And are they? Sorry to interrupt, Eric. Are they liquid herbs or are they actual herbs? Like how do you? Is it?
It's come
in different formats. So how do you normally use them?
Most of the time, liquid. There are some companies that have it in capsule form, but I find it to be more effective in liquid form, and that's usually how it is. Most of the, there's not a lot of brands of bugleweed just because, again, it's not as too common, but most of the brands, it's in liquid form. And, there are some people that want to take it in capsule just because the liquid doesn't typically taste really good. But, but again,
liquid herbs always taste disgusting. You go to a Chinese herbalist or a herbalist who's like, oh, liquid herbs. But you usually want to take it in liquid form. And is it just when whilst you're dealing with those acute symptoms, or is that something that you would take on a regular maintenance basis? So to answer your question, when I dealt with Graves, I took bugleweed and motherwort for approximately 9 months, and I haven't taken either of them since then, since 2009. Okay. So they're not really something that most people would need to take on a maintenance basis. So as long as they're able to get into remission, able to regain their health, then it's something that ideally would want to stop taking. Yeah, there's that, because even with the diet you were saying before, like with the AIP, it's not commonly used as a long-term lifestyle approach. It's that acute, dealing with that acute stage.
Exactly.
So, just wanted to clarify that. So liquid herbs, lithium. So I did interrupt before. Were there other sort of supplements or herbal things that you wanted to cover?
Yeah, well, for symptom management, there's the bugleweed, the motherwort, the lemon balm, the L-carnitine. And I mentioned the lithium orotate. Now, one of the controversies of thyroid health, both Hashimoto's and Graves, is iodine.
I was about to say iodine, yeah. Okay. So what's your take on iodine?
Well, iodine, I'm bringing it up here because it can, in some cases, be used as symptom management for hyperthyroidism. Now I don't do that. That's not the approach I take. But in the past, before radioactive iodine, before they had that, some practitioners actually used Lugol solution, which is potassium iodide, as a way of managing the symptoms. Now, the thing is with iodine, it could work both ways, meaning that, it sometimes could help, but sometimes it could make things worse, and so that's why I'm pretty cautious about it. I'm bringing it up just again because it can in some cases.
It's in the,
but also it could sometimes be a potential trigger. It could sometimes like exacerbate the autoimmune response in both Graves and Hashimoto's. And and there's numerous reasons. If someone is low in antioxidants, that could be a factor, and that's why a lot of times, like a practitioner who recommends iodine will say, well, take selenium and take vitamin C, along with those. And sometimes that'll be helpful. I mean, you definitely, if you take iodine, like a separate iodine supplement, you probably wouldn't want to take it without supplementing with selenium and some other things like vitamin C, magnesium, but, that might not be enough. And, again, to me, it's not, there are other safer approaches to managing symptoms, and, the argument could be made, well, how about if you have a deficiency in iodine? And like if some, and with any nutrient deficiency, any vitamin, mineral, fatty acid, you of course want to, eventually correct that. But, in the past, it's not as common today, but, when I was dealing with Graves, it was common practice to take real high doses of iodine. You would see that a lot more commonly, like taking, 25, 50 milligrams of iodine, which, like usually you want to dose, in the micrograms. And I'm definitely not anti-iodine. I actually had positive experiences with iodine personally in the past. But I've seen mixed results, like when I guess going back when I dealt with Graves, I actually took iodine just because it was, at that time, it was recommended, at the seminars I took, they spoke about it. And again, I didn't have a negative experience. And if anything was positive, and then after, when I started work with people, I actually had them test for iodine and, if deficient, supplement with iodine. And, and again, I just saw mixed results. A lot of people did fine, but then there were people that didn't do fine with the iodine. Again, they would.
It's so, we're all complex, aren't we? Like, there's no one size fits all. It would be nice if there was, but I suppose it sounds like it's, I mean, I guess this is where, because I'm not a practitioner, I kind of steer away from the controversial things. I would never kind of talk about something like that because I don't know, and I'm not a practitioner, and I haven't. Actually, I've never taken iodine. It's a small amount is in a multivitamin supplement that I take, but I'm not supplementing specifically with iodine. But it seems to me, I think I get concerned when I hear people, whose practitioners just put them on iodine without any testing or really without, that still seem to be in that, if you've got, well, particularly Hashimoto's, you just, you need iodine. I'm like, well, that sort of sounds concerning to me. When there is all of this complexity around it, I think there's still a lot of people and practitioners that perhaps aren't recognizing that.
Yeah, I agree. I mean, you don't want to blindly give anybody, or just, for the listeners, you don't want to blindly take, higher doses of iodine. And even with the testing is controversial as well. Like you don't want, like, blood testing is not really reliable. If anything, urinary seems to be the most reliable, but it's still not perfect. And even if you have an iodine deficiency, it doesn't mean that you will do. Well, first of all, it doesn't mean that you require like massive doses of iodine. And it doesn't mean that you will do okay with even smaller amounts. You might still have some problems because, again, you might have to, improve like your glutathione status, which is, I'm sure you're familiar with glutathione, master antioxidant. So again, there's a number of reasons why people can't tolerate iodine. But again, to me, that's mostly on the back burner. Like if we're going to do anything with iodine, it's not initially. And, a lot of people are fine with that because a lot of endocrinologists will scare their patients into like, more so with hyperthyroidism. I don't hear too much with the Hashimoto's, but a lot of endocrinologists will tell their patients with Graves disease or other hyperthyroid conditions, whatever you do, make sure you avoid iodine, even like, higher sources of food like sea vegetables and all that. They'll tell them to be real careful. So that a lot of people, when they speak with me, they're already like terrified of iodine. They're, they're like, they don't want anything to do with iodine. And, and like I said, usually I don't do anything with iodine. I've spoken about in my book, Natural Treatment Solutions for Hyperthyroidism and Graves Disease. But again, it doesn't mean, and that was, again, when I wrote the first edition, that was 2011, so quite some time ago. I revised it a few years later, but still, things have changed since then, and so that's why I have, like you, a podcast and a website, so I can, it's easier to update, come out with updated articles and episodes rather than, update books and all that. But so I guess just be careful with the iodine would be what I would say.
Yeah, that sounds like good, sensible advice. Are there any, when we're talking about safety, and I mean, my understanding, is that there are probably more safety concerns when it comes to Graves' disease and with Hashimoto's. I mean, you are sort of much more revved up and have the, heart complications. And are there any other things that people need to be aware of in terms of that safety whilst managing it sort of naturally or trying to go down this sort of natural path? Are there anything that people need to be aware of so that they're managing their health in a safe way?
Yeah, I'm glad you asked that question, because I think some people don't take it seriously enough. And, like elevated thyroid hormone could definitely put stress on the cardiovascular system, having that elevated resting heart rate, also bone density, could affect bone density. So, yeah, I would say this, like, if you're, so I took the herbs, but if they didn't work, I would have taken the medication. You don't want unmanaged hyperthyroidism, and everything's risk versus benefits. I mean, a lot of people get nervous about taking a medication because typically anti-thyroid medication, very common to have side effects. It'll affect liver enzymes in a number of people, sometimes suppress white blood cell count. I mean, so people read these, scary side effects. And, the thing is, not everybody, I mean, there are people that tolerate the antithyroid meds really well. And the meds the herbs don't always work. So if someone is taking antithyroid medication, again, I would never tell them. I mean, I don't have prescribing rights, so even if I wanted to, I couldn't tell them really. But, I would never, even if I did have prescribing rights, I would not tell someone to stop taking a medication and switch to bugleweed, because again, we don't know for sure if the bugleweed would work. Now, if someone is not tolerating the antithyroid medication, sometimes switching to different antithyroid medication, like there's one called PTU, which sometimes, some people get more nervous about that because there are some studies where it caused liver failure. Again, very, very rare for that to happen. Again, remember, risk versus benefits. And over the years, I've had a number of people on PTU, and, never had really anything bad happen, as far as like liver. Worse that happens, liver enzymes get a little bit elevated. And then, they do a comprehensive metabolic panel or a hepatic panel to find that out. And then they take the person off the medication. But if they are unable to take the antithyroid medication for any reason, I mean, there's beta blockers. Some beta blockers affect the conversion of T4 to T3, so they'll decrease the T3 that way. And, of course, T3 is the active form of thyroid hormone. There's, you're probably familiar with, I don't know how popular it is in Australia, but LDN, low dose naltrexone.
Oh, yeah. It's sort of on the outskirts, I suppose. Okay. There's a little bit, so happy to talk about it. In fact, someone was asking about that recently, so happy to, if you want to cover low dose, I can just say LDN.
LDN, low dose naltrexone, LDN. And, it does require a prescription. I mean, here in the United States, it's fairly easy to get, because if your prescribing doctor won't give it to you, there's like websites like ldndirect.com, ldndoctor.com. But so you could actually go online and work with someone remotely to get a prescription. And it's, for the most part, it's fairly safe, like compared to, other medications, kind of like thyroid hormone. Thyroid hormone is fairly safe. It's not, it's more, I think of it more as a replacement than really a medication, taking thyroid hormone. But, so LDN is not exactly the same, but, it's, I mean, some people will cause insomnia, which isn't good. But overall, it modulates the immune system. It potentially can calm down the immune system. And it's not just for Graves, but for other autoimmune conditions. So actually, a lot of people with Hashimoto's take LDN. The downside of LDN, it's also hit or miss. So not everybody that takes it, it doesn't always work. And then, of course, it's not addressing the cause of the problem. So, you ideally want to find out like what's causing it, so someone doesn't have to continuously take LDN. But there are people, just like there's people with Hashimoto's, and they'll be on thyroid hormone, and that's all they'll do, and they won't do anything to address the cause, just because either they weren't told to do anything, or there's some people that just don't have an open mind. And same thing with LDN. There are some people that are either told by the prescribing doctor, just take it, and if it's working, don't stop taking it. And then there are those who just don't want to bother finding their triggers and removing their triggers. But yeah, so at low dose naltrexone, it's typically people start at real low dose, like maybe 1 milligram. I think sometimes even like half a milligram, gradually increase, usually to 5 milligrams. In some cases, they might go a little bit higher than that, which I actually didn't know until recently. I had a patient that was telling me that they were taking 6 milligrams, and to me, the highest prior to that I heard was 5 milligrams. And she said the practitioner said that we could go up to 10 milligrams if necessary, which is still fairly low dose, but compared to just regular naltrexone. But so it is an option. It's an option if someone can't take the antithyroid medication, maybe look into low dose naltrexone, because it is the benefit is it like Graves as well as Hashimoto's, these are autoimmune, more immune system conditions than thyroid conditions. And LDN is not addressing the cause, but at least it's acting on the immune system. So if someone is taking thyroid hormone and they have Hashimoto's, the immune system is still damaging the thyroid gland. And, with Graves, the immune system is still attacking the TSH receptors. They're taking LDN, and if it's working, it's actually halting that process. So it's not doing anything to address the cause of the problem, but at least it's, the thyroid is
still dampening that immune response. And can it be taken alongside medication, either for, say your thyroid hormones in Hashimoto's or your antithyroid medication in Graves, or is it something you would do instead of?
No, people do take both. I mean, there are people that take thyroid hormone with LDN, and same thing with antithyroid meds. The only thing you need to be careful about, let's say if you're taking thyroid hormone, for example, or if you take whatever you're taking either thyroid hormone or, antithyroid medication, and then all of a sudden you introduce low dose naltrexone, and if it works, you might not need as high of a dose of the thyroid hormone or the antithyroid. So if you're taking, levothyroxine or desiccated thyroid, and then you introduce LDN, you might start feeling hyper. And if that's the case, that means that the LDN is probably working, and you need to, and the same thing with the opposite with, if you have Graves, you're taking antithyroid medication, and, let's say if it's helping, but your euthyroid, everything's look good with the antithyroid meds, but then you add LDN, it might push you towards the hypo side. So yeah, that's the one thing you'll need to be aware of if you're taking both. But yeah, there are people that do take the medication or the thyroid hormone replacements along with the low dose naltrexone.
Yeah, that's really helpful. I've wanted to talk to someone about that, and it hasn't sort of come up. So thank you for that.
Sure.
Yeah, I think that makes sense. Another question that I think relates to a lot of people with Graves' disease that actually end up having their thyroids removed. Is there any different? Obviously, then if you have your thyroid removed, you're going to have to go on thyroid replacement medication. But is there anything that you'd want to say in terms of that removal of the thyroid in this context of Graves' disease and natural approaches?
Yeah, I mean, there's definitely a time and place for thyroid surgery. So one thing I would say is it should be in most cases a last resort. When it comes to Graves, obviously if someone has like thyroid cancer, that might be a completely different story. Yeah. But if someone has Graves' disease and you're you have your very first visit, especially with the endocrinologist, and they're talking about surgery, you might want to, get a second opinion, even though, again, it's not uncommon for multiple endocrinologists to recommend surgery. So that's where maybe speaking with a functional medicine practitioner, natural healthcare practitioner. But, if you do choose surgery, just a few things. So one, definitely choose your surgeon wisely. You want to make sure you choose someone who has a good amount of experience removing thyroid glands, because, again, complications are, I don't want to say like super common, but they're also not rare, where, like it's sometimes damage happens to the parathyroid glands. And once the damage is done, they, like if they accidentally cut out one of the parathyroid glands, they can't, again, they can't, the damage is done pretty much. Yeah. And, you could have other, anyway. So yeah, there definitely are risks. So choosing your surgeon wisely. And I do have a podcast episode on talking about, just reasons to avoid thyroid surgery. I think it's like 4 reasons to avoid thyroid surgery, but it does talk about if you do choose thyroid surgery, like how to like choose like a surgeon, like, with experience. But then also remember, Graves is an immune system condition. So if you get the thyroid surgically removed, it's, the problem with any autoimmune condition, whether it's Graves or Hashimoto's, is you have increased risk of developing other autoimmune conditions in the future. So if you get the thyroid removed, it's definitely going to get rid of the hyperthyroidism because you no longer have a thyroid, but you still are at risk of developing other autoimmune conditions in the future. So yeah, I would say you still want to do things to optimize your health. If you have a leaky gut, obviously getting your thyroid removed is not going to do anything for the gut. It's not going to do anything for the adrenals, not going to do anything for your toxic load.
Yeah. So yeah, it might solve one problem, but it's certainly not the complete solution. There's no complete solutions. I think that seems to be across the board with all thyroid conditions, and is that they all require this sort of multifaceted, holistic lifestyle approach. And so there's no quick fixes. There's no easy outs. There's no kind of one solution. It's complex.
Yeah. And one other thing I want to say, Annabelle, is you could always get the surgeries, but once you get the surgery, there's no turning back. And that's another reason why you want to just be careful. Like, again, my goal is not to talk anyone out of getting thyroid surgery, but, just, just like I said, it should, in most cases, as well as radioactive iodine, those should be last resorts, because especially with the surgery, you get your thyroid surgically removed, and, you're definitely going to be on thyroid hormone replacement for the rest of your life, which isn't the end of the world. But again, if there is a chance to save your thyroid, why not, take the necessary steps to do that?
Yeah, it's probably a good segue into giving your podcast and products a bit of a plug, because Save My Thyroid is the name of your podcast. I think that's, and I guess is that sort of the heart behind the name of your show? Is like, what can we do to save your thyroid?
Exactly. I mean, there's definitely more of an emphasis on hyperthyroidism with the podcast. In my opinion, people with Hashimoto's need to save their thyroid too, because again, the immune system is, so it goes both ways. But, but again, when I started the podcast, honestly, the goal was to emphasize hyperthyroidism more, just because, there are podcasts like yours that focus more on, the Hashimoto side. And so I was so again, there are episodes, of course, I'll be also having you as a guest on the podcast, and we'll be, talking about your book, and, so it won't be focusing on hyperthyroidism. That's typical when I have guest experts, a lot of times they'll be focusing on both, hyperthyroidism, Hashimoto's. And, but yeah, definitely that was the main reason I put that together, is just because my experience with hyperthyroidism, and just, again, the majority of people I work with have hyperthyroidism, whether it's Graves or, toxic multinodular goiter or a different type of thyroid condition. So.
Well, I think that's really good. So, I mean, of my listeners, if you're listening and you're looking for good Graves hyperthyroidism resources, go check out Save My Thyroid podcast if you haven't already. And Eric, you've got a couple of books as well. And like, I think we could keep talking thyroid for ages, but I'm mindful, we're probably at a listenable limit, and you've got to head off to bed. So, I think this has been, I've learned stuff. This has been a really helpful conversation. I think it's good to go over some of the basics and then dive into some things a little bit deeper. I think there's probably lots of other sort of directions we could have taken, and lots of things yet that we haven't explored. But where should people go? I'll put links in the descriptions for everything, but if people are just listening and they want to check you out, maybe they're local to you or, in the States and want to work with you, where should people go? How do you like people to connect with you?
Yeah, so you mentioned a podcast, Save My Thyroid, which you could find pretty much on any podcast platform. There's also my website associated with the podcast is savemythyroid.com. But my main website is actually naturalendocrinesolutions.com. And so that's been around for quite some time, has lots of articles and blog posts related to actually both hyperthyroidism, Graves disease, as well as hypothyroidism, Hashimoto's. And then you mentioned the book. So I have 2 books, one, Natural Treatment Solutions for Hyperthyroidism and Graves Disease, and then another one, Hashimoto's Triggers. And then I guess the final one would be my my YouTube channel, Natural Thyroid Doctor is my YouTube channel. And so those, so you could, but yeah, I would say probably the top 2 would be, the website, naturalendocrinesolutions.com, and then, the Save My Thyroid podcast.
Yeah, excellent. Well, yeah, I'll make sure I link, I will link to all of those. Well, look, thank you so much, Eric. It's been really lovely to meet with you and chat and really get some really good information out to, I think at the end of this, if you've listened with Hashimoto's, you will have got a lot out of it as well, but I do like to put some content out there for the Graves listeners as well. So I really want to, thank you for your time and your expertise and all that you do in the thyroid space as well.
Thank you, Annabelle. It's been a pleasure.
The information presented and discussed in this podcast is not intended to diagnose, treat, cure, or prevent any disease and should not be used as a substitute for proper advice from a qualified professional.